Hi, I'm Dr. Cecil Walker of Chiro One Source, and I have Dr. Stephen Weiniger of PostureZone here with me today. I really appreciate you being here.
Thank you.
We've been talking about taking posture pictures in order to assess posture. Can you tell me exactly how that works? What are you assessing when you look at a posture picture?
When you're looking at a posture picture, you're looking at literally the structure of somebody's body, what they're doing to keep themselves vertical, to keep themselves from falling down. And by looking closely at the individual posture zones, the head, the torso, the pelvis, and where you're standing with your feet, you can get a sense of what each structure is doing to compensate and balance one structure on the other. So if you would stand in front of the grid, and it's great for when you're taking a picture to have a consistent background for comparing today's picture to tomorrow's. So I'd like you to stand in the middle of the grid, step to the left a little bit, stand tall, look straight ahead, take a step or two with each side, and look straight ahead. I like the back and forth, that works. So looking straight ahead, when we're looking at a posture picture, we start from the bottom up. So looking at the feet, we're looking at the symmetry of how the feet are standing. Are they both pointing straight ahead? Is one foot pointing out compared to the other? Is one foot rolling out compared to the other? You'll notice looking at his feet right now, don't look down. You'll notice looking at his feet right now, the right foot is rolling out a bit more than the left. Both feet are rolling out. You can see almost the outside edge of the leather going over the sole of the leather. When I'm looking at his feet, even with where he's standing right now, you can see that the crease of the left leg is pulling out a bit more compared to the right. When I'm looking at the pelvis, I want to look at the level of the belt. Looking at the arms, looking at the left side, look straight ahead. Patients always want to look at their bodies. Look at the distance from the arm to the body on the left versus to the right. Notice the difference between the arm-body interface on the left versus the right. Look at the height of one hand compared to the other hand from a vertical distance point of view. Look at the overlay of one thumb over the body compared to the other thumb over the body. That indicates an asymmetry between the torso and the pelvis. The pelvis might be going one way, the torso might be going the other way, but there is an asymmetry, and that's what we're looking at when we look at posture from a fine, subtle structural point of view. Moving up, you also want to notice the internal rotation of one hand versus the other hand. When one hand is more internally rolled in, that says that there's something happening in the shoulder on that side as well. Coming further up, you'll notice one shoulder compared to the other, that there's a difference in the height of one shoulder, also in the rolling. You'll notice just on the crease of his clothing, you'll notice that there's more of a crease coming in on this side than there is on this side, indicating that there's some kind of torso rotation in that direction. Something we look at a lot is the distance from the ear to the top of the shoulder, what we call this the length of the neck on that side, and it's more than high shoulder, high hip. It's about the way the neck is developed from the way the body is moving over time. And looking at the actual head rotation, looking at the ear, how much of the ear are you seeing on one side compared to the other, and then stepping back and looking at the whole structure. Looking at the middle of the head compared to the middle of the feet. Looking at the feet down the middle, I can see the center line of a grid. I should see the same center line of the grid in the middle of the head. If a body is deviating to one side or the other, that usually is not the case, and that's one of the things that we measure with a PostureZone assessment. Relax. You can't see what I saw looking at you, but when we take a posture picture of you, you will see that.
Cool. Well, I very much appreciate it. And check out the link at the end of the video if you want to engage further in the CPAP program.